results of an important new medical study were released today, and it is one that can save lives.
That study shows conclusively that early treatment of minimally elevated blood pressure can actually reduce or prevent major cardiovascular events. With more on that study and who would benefit, our doctor on call, Zorba Paster, joining us live from his office in Oregon. Dr. Zorba,
Hi,
welcome.
Zorba. It's a pleasure to be here.
Well, tell us a little bit about this study. What is it exactly? What is it, the finding?
Well, this is the study. It's a study of studies. So what they did is go back into all of the other studies that looked at mild high blood pressure, what we used to call mild or stage 1. And that's a blood pressure between 140 and 159. That's the systolic, and a diastolic blood pressure between 90 and 99. Now, for those minimal elevations, they're not necessarily minimal at all. They wanted to see, is there now evidence conclusively that means that if you have that blood pressure treated, you won't get a heart attack and stroke, or you're less likely to get it? And the answer is undoubtedly yes, that this type of stage 1 high blood pressure should be treated. And the real issue is many people don't get treated. They come into their doctor and they go, well, I'm not going to be on a medication, I don't want to take something. And the reality is people who are doing that are playing with fire. The data now is in. It's a major difference in stroke reduction and heart attack reduction.
So we're talking about treating it with medications.
Absolutely. Absolutely. Very good medications. And the medications now, the nice thing about the medications we have today is we have generic medications for the most part that can treat high blood pressure. We're talking about pills that cost maybe $4 to $8 a month that people can take. One of the issues that people often have is they have side effects, and if one medication doesn't work, you can often go to another medication. The other issue is that we were not 100% sure as doctors that this type of blood pressure treatment has really been proven now, and this really shows that it has.
When do you start seeing patients, the age that they start having blood pressure issues, and is there any symptom other than just going to your routine physical and having it detected by your physician?
There is no symptom at all, and that's exactly what the problem is. Often people with high blood pressure don't feel anything, and you find it out when you're going into the office for anything that you might be going in. It becomes more common as you get older. So, you know, a 50-year-old is much more likely than have it than a 25-year-old. And once you get over 65, it's about 50 to 60% of the people actually have high blood pressure. Other factors are obesity, diabetes, poor lifestyle, too many brats, too much beer, family history. Am I sounding like Wisconsin, or am I sounding like Wisconsin?
Too many close Packer games.
That's right. That'll raise your blood pressure. So get your numbers checked, and you might want to start treating it.
Yeah.
Exactly. That's the bottom line.
All right, Zorba. Thank you very much. Happy holidays to you.
Happy holidays.
Happy holidays to you.